Hi, my name is Denise, and I'm an insurance agent in Tucson, Arizona, specializing in Medicare supplements, Part D drug plans, and Medicare Advantage plans. This video provides a short introduction to your Medicare choices. Now, I'm assuming you've got your Medicare Part A and B, so let's quickly review how they work. Part A covers hospitalization, skilled nursing facility charges, home health services, and hospice. It has an annual deductible and no monthly premium. Part B pays 80% of your doctor bills, ambulance charges, emergency room charges, and many other non-hospital medical services. Part B has a monthly premium, and it is $110.50 if you're new to Medicare this year. There's an annual deductible, and you pay 20% of all Part B bills. So let's look at your choices for Medicare coverage. You can add a Medicare supplement, which will fill the gaps in your Medicare and pay your co-insurance and the deductibles. And you can also sign up for a Part D drug plan. Now, Medicare only as a choice is not actually a good choice, and that is because you pay 20% of your Part B bills, and there is no cap on your co-insurance. And 20% of bills for chemo and radiation treatments or other serious illnesses can add up over time, and again, there is no cap on your co-insurance. So to protect yourself from ever-growing and never-ending medical bills, you can get a Medicare supplement. These fill the gaps in Medicare. They can be used anywhere in the U.S. because they work alongside your Medicare. The plans don't have exciting names, but rather they have letters. And each plan fills the gaps in Medicare in a slightly different way. Plans C and F are the most popular plans because they fill most of the gaps in Medicare. Now, the fuller the coverage you sign up for, the higher your premium is going to be. And in 2010, there are going to be some big changes with Medicare supplements. 2 new plans will be introduced that have co-payments and therefore lower premiums. Now, the one negative about Medicare supplements is that premiums do go up over time. If you get a Medicare supplement, you should sign up for a Part D drug plan. These are bought through insurance companies. Premiums vary, and you need to do your homework to make sure the plan that you sign up for is actually going to work for you. Believe it or not, there are 46 Part D plans offered in Pima County, Arizona. And you need to pick the right plan because you can only change your Part D at the end of every year. So now let's take a look at your options for your Medicare coverage. You can add that Medicare supplement and sign up for Part D, or you can get your Medicare benefits in a different way, and that is through Medicare Advantage. Now, Medicare Advantage plans are offered through insurance companies like Secure Horizons, Health Net, Humana, CareMore, and a number of others. They usually include Part D. Most of these plans are HMOs, which involve a local network, and you must get a referral from your primary care physician to see a specialist. There are some PPOs still out there that do allow you to go out of network for a slightly higher copay for your care. Advantage plan premiums are lower than Medicare supplements, but they do require copays for doctor visits, hospital stays, and all of your medical services. Arizona still has Advantage plans with 0 premiums. So, once again, let's look at your choices for your Medicare coverage. So now that you understand a bit about your Medicare choices, you need to decide which type of coverage is best for you. Do you feel most comfortable on the left side here with a Medicare supplement and a standalone Part D, or do you think Medicare Advantage might work for you? Now, this is the point at which I usually spend a lot of time talking to people about their situation, their concerns, and what they feel most comfortable with. And I do compare costs involved with each of these options. Now, here's the bad news. This is just the first decision that you need to make about your Medicare coverage, because there is actually quite a bit more to consider. And that is, what company will you finally get your coverage through? And this is where you need to work with an insurance agent like me. Now, this next slide gives you some idea of the number of choices that you have. For example, let's say you decide to get a Medicare supplement. Well, there are many companies, and these are just 3 of probably 20 or 30 companies that offer Medicare supplements in Arizona. And of course, you then want to get a Part D plan, and I spoke of the 46 plans that are offered in southern Arizona. Now, if you decide Medicare Advantage is right for you, these are the major players in southern Arizona. And as you look at these companies, you will find that they each have a number of plans to choose from. Humana has an HMO and they have a PPO. CareMore has special needs plans for people with chronic illnesses. Secure Horizons has several choices. Now, as you consider these plans, there are also lots of questions you need to ask. Are all of your doctors in the network? Does the plan have a cap on your out-of-pocket expenses? How does the Part D coverage work, and does it cover all of your drugs, and at what cost? And there are many other questions that you're going to ask as you think about the coverage that you're finally going to choose. So, I represent Medicare supplement companies and all of the Medicare Advantage plans that I've mentioned here. And in full disclosure, I get paid a commission by these companies if I sign you up with them. And this is the case with all insurance agents, but I don't push one type of coverage over another, and I don't promote one company over another. So your final decision about your Medicare coverage is going to depend on your particular situation and your experience with insurance and with your health care. So I hope this video has been helpful to you, but it really is meant to just get you thinking about your Medicare choices and all of the questions that you might have about your Medicare coverage. And hopefully it will make you feel comfortable with the idea of working with me. So if you have any questions, you can call me or email me, and I'd be very happy to work with you as you make these important decisions about your Medicare coverage. Thank you for listening.